We're still in lockdown, and it's the April 1st edition of Health in 2.00. Matthew Holt. Well, at least we have deals this week to talk about.
We do have deals. We also talk about this, actually, our first ever Health in 2.0 podcast edition as well, because it's now going to be podcasted as well as videocasted after only 115 or how many episodes.
Well, yeah, that viewer question we got at 113 just set this whole thing.
Put us in overdrive.
Now we have confirmation. People are listening, and so why not start a podcast too?
All right.
You ready? Get your timer ready.
I'm ready. I have a timer.
Okay.
We have no nonsense edition because we're locked down. Go.
All right. So Olive raises $51 million. General Catalyst is in this round. Ascension. And what does this do exactly?
So that's a good question. It's some kind of revenue AI figuring out machine automation operations at the back office of hospitals. Sounds very, very important, very, very impressive. They've been around. They actually came to Health 2.0. I wasn't quite sure what the hell they did then. But it's a sort of back office AI stuff. I think Qventus and a bunch of others are kind of in this space, but these guys have focused more on revenue cycle management and stuff for hospitals. And why now? I don't know, but sounds like a big deal. And it's probably one of those companies which, if it makes it, will be a big player because everyone needs that.
Yeah. How about Bright.md? They closed an $8 million C.
Okay, they've been around a while. They do kind of asynchronous telemedicine. They had an early COVID-19 thing out, pretty cool company. You can basically do a questionnaire. It gets routed based on whether you're healthy or sick, and you usually get you're usually fine, and you get a drug sent to the pharmacy, and the doctor signs off.
All right, how about AristaMD? They get $18 million in a B round. Cigna's in this. Yeah,
a bunch of people are in this. I think Cigna was in it, and I think a hospital, Memorial Care from Southern California is in this. And this is very similar to the company who Gil Ado works for, whose name come on, help me with the name! RubiconMD. So what this space is this is also telemedicine, but this is a physician, primary care physician consult to a specialist. So instead of, especially AristaMD has done a lot with Medicaid clinics, and Blue Shield paid for them to have a whole bunch of licenses at sort of federally qualified health centers. Instead of having to wait to get to a specialist who probably won't see you or can't see you, you get basically your GP puts in a question, send to the specialist, they get an answer consult back in, a day or so. Whoop, you're out here.
Yeah, I mean, just keep talking. Why don't you stop?
Well, I'll keep doing it. They get a consult back in a day or so, and it's a much more effective way of getting that specialty consult. So there are a couple of companies doing that. I mentioned Rubicon, and there's one other in San Francisco, which I've also forgotten the name of. But you know because our friend from the AMA has gone there.
Oh,
you've forgotten it too.
It started with a K, didn't it?
Yes,
anyway, it did.
There's a few of these companies doing it. So what's happening is telemedicine. What's happening is you have Bright.md and these guys, is telemedicine is kind of breaking up its component parts. There's synchronous, there's asynchronous, there's people inside the hospital doing live video like your friends at Cloudbreak and Bluestream. There are the bigger people who are doing not emergency, but there are people like InTouch who are now part of Teladoc who are doing kind of inside the hospital video, and you've got Amwell and MD Live and Teladoc who are doing the direct-to-consumer stuff. So as telemedicine gets its moment, what's happening is that more and more pieces that are breaking up into its component little parts, and at some point somebody will come along and say, why aren't all these in one company, and we'll put them all back together again. And that's really going to be Teladoc or Amwell or Google or whoever the hell we know. So
got it.
That's it.
That's Kelsey Millard's company. What's the name of that? It's going to drive me nuts.
Remember this because we don't remember the name of the company.
Sorry. Usually I remember that stuff.
Do your, I'll quickly Google it while you do your rap.
Doing my rap. Okay. Well, I'm disappointed at some of these. We had a couple other deals that we didn't get to, so we'll have to include them in the next episode.
Oh, well.
So people can follow along. Like we said, this is our first ever podcast episode, so we hope you're enjoying this. If you want to find out more about what's going on in the fabulous world of health tech fundraising, you can always follow us along on Twitter. He is at BoltyBoy. I am at Jess DeMassa. And if you wanted to keep up to date on what's happening from a healthcare industry perspective on COVID-19, definitely sign up for the Healthcare Blog's email newsletter. So we are publishing content daily, including interviews that I'm doing with different people and others who are weighing in on the health policy implications, the cost implications, what it means for the startup fundraising market. I mean, you name it, people are covering this. So sign up at thehealthcareblog.com and get the curated version of the blog delivered right into your inbox. Mr. Holt, did you find out what it was?
No, can't find it.
Oh my God, we're useless. We are absolutely
I spent all that time. I Google around like.
Seriously, you are useless. How can you not Google? Like,
Hang on.
He's still looking for our
Do some other wrap up part.
I don't have
Sitka.
I had a K in it, damn it.
Sitka. So they haven't got, by the way, AristaMD got 16 million, RubiconMD raised a bunch of it, 20 million a couple of weeks ago. Sitka is still poor as far as we're aware.
They are, but somebody should definitely throw some
Somebody
money.
will be jumping on them too.
I mean, let's start an asynchronous virtual care arms race here. Let's do it.
This is asynchronous virtual care consults, especially consults.
Oh my God.
It's the 4 down, 3 across at the bottom of consult.
I don't know. This whole sector is going to boom. I mean, it's going to be exciting to watch once we can actually get out of our houses and watch it.
Yeah, but I think in about 6 months when we're finally out of the house, I'll be desperate to go anywhere. So sign me up for a doctor's appointment. I'll wait in that room for like a month. I don't care.
Oh God, the poor people
anywhere that my kids
next to you in the waiting room. All right, folks. Well, I'm Jessica DeMassa. That's Matthew Holt. Thanks so much for joining us on this episode of Health in 2.00. We'll see you soon.